first witness is Dr. Anthony Levatino. Dr. Levatino is a board-certified obstetrician gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OB/GYN at the Albany Medical College. And Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument, and when it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times. Sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.
Why did you end your practice of doing abortions?
I did over 1,200 abortions over a 4-year period in private practice, not counting the ones that I did during my training. I met my wife during my first year of training at Albany Medical Center. We got married about a year later and found that we had an infertility problem. After years of failed infertility treatment and several years trying to adopt a child, we were blessed with adopting a little girl that we named Heather in August of 1978. As sometimes happens in those situations, my wife got pregnant the very next month, and we had 2 children 10 months apart. 2 months short of my daughter Heather's 6th birthday, she was killed in an auto accident and literally died in her arms in the back of an ambulance. Anyone who has children might think they have some idea of what that feels like, but unless you've been through it yourself, you have no idea whatsoever. I know people find it hard to believe, but what do you do after disaster? You bury your child and then you go back to your life. And I don't remember exactly how long it was after my daughter died that I showed up at Albany Medical Center OR number 9 to perform my first second trimester D&E abortion. I wasn't thinking of it as anything special. This was routine to me. But I reached in, literally pulled out an arm or leg and got sick. You know, earlier on I described stacking up body parts on the side of the table. It's not to, gross people out, to use a simple term. When you do an abortion, you need to keep inventory. You have to make sure you get 2 arms and 2 legs and all the pieces. If you don't, your patient's going to come back infected, bleeding, or dead. So I soldiered on and finished that abortion. And I know it sounds, as I said, hard for people to believe, but I'm telling you straight up my experience. You know, after over 1,200 abortions, first and second trimester up to 24 weeks and all the rest of it, and being very dedicated to it, for the first time in my life, I really looked. I really looked at that pile of body parts on the side of the table. And I didn't see her wonderful right to choose, and I didn't see all the money I just made. All I could see was somebody's son or daughter. And I stopped doing late-term abortions after that, and several months later stopped doing all abortions.
Do you support making it legal to abort an unborn baby for any reason, up to the moment before birth?
Senator, let's have that intellectual discussion that you
Okay.
want.
We could start if you'd answer my
And-
question. I can't go to my next
well-
question until you answer that question. Professor Goodwin, help me understand your point of view. I think this is a yes or no question. Do you support it being legal to abort an unborn child up to the moment of birth?
Senator Kennedy, it is not a yes or no question. I support women like Ms. Zarowski. Women across
No,
this.
ma'am, I don't, I think it is a yes or no question.
No, well,
If
let me
if
answer.
there were a law that's, I'm just trying to understand your perspective, and I'm not accusing you of this.
Of course
but,
not.
But, you know, people sort of talk around this issue. If there were a bill that said that a woman has an unfettered right to abort an unborn baby for any reason up to the moment of birth, would you vote yes or would you vote no?
Senator Kennedy, I refuse to be shackled by your question. What I have answered is that there are conditions that
You don't
occur
know
during
whether you would
pregnancy.
vote yes or no?
There are conditions during pregnancy that mean after 10 weeks,
No, I said
14 weeks,
I said
20
unfettered
weeks,
discretion.
24 weeks,
You
conditions such
would
as Ms.
support-
Zarowski.
you're here
and
advocating-
I would support her life.
I
would
understand,
support her
too,
personhood.
But you're advocating a law.
I support her
You're
personhood.
advocating a law that says that an unborn baby can be aborted up to the moment of birth for any reason, are you not?
Let me clarify what the 14th Amendment says in the first sentence, that citizens of this United States are individuals that are born. That is what our Constitution says.
But
Do
why
you
won't you
support our
answer my
Constitution?
question, Professor? I'm not trying to argue. I just want to understand what your position is, and I think you're afraid to say that you do support that. If you do support it, I think you, just for the purpose of an intellectual discussion, you ought to just say so.
For purposes of an intellectual discussion, I'm happy to have that with you, but
Well, then
that's not the tone of...
could you answer my question? Do you support, please? I mean, you teach, okay? I'm sure you've had students ask this question. Do you support making it legal to abort an unborn baby for any reason, up to the moment before birth?
Senator, let's have that intellectual discussion that you
Okay.
want.
We could start if you'd answer my
And-
question. I can't go to my
well-
next question until you answer that question.
I want you to be able to go to your second
good.
and your third
Answer it for
questions.
me.
I do. But as I have explained, there are many different conditions.
No, I said
during
unfettered
a
discretion, no conditions. I'm making it easy for you.
Well, I have already shared with you, Senator, that I
I get
support
it.
women's
I don't want to use
person-
all my time. You're not going
And
to
I
answer
support
it,
Ms.
and that is your
Zarowski's
right. But I
personhood.
would respect you more if you just say, "Here's
I'm
my
sorry
answer."
that you don't respect
I
me
do
very
respect
much.
you, but I said I'd respect you more if you just answer my question. Doctor, tell me how to say your last name. Ms. Dr. Rubenhorst. Do you support a law that would allow, for any reason, unfettered discretion, the abortion of an unborn child up until the moment of birth?
No.
You don't. Dr. Verma?
Senator Kennedy, so I'm the one doctor in this room that does provide abortion care, and I can tell you that does not reflect the reality of
No,
abortion
I
care.
understand. I'm just asking the question.
It simply doesn't
But do you
happen.
support it? There are bills before Congress that will allow that to happen.
That's
You don't support it, or are you going to be not
again,
answer
as
my
the-
question?
As the doctor in this room who does provide abortion care, that is not how abortion care in this country works. It's a hypothetical that does a disservice
But if a
to our
patient came to you
patient.
and said, I'm going to probably have a baby this week and I've changed my mind, and I would like you, doctor, to abort the child, would you do it?
That is not how abortion care in
But
this
if
country
a
works.
patient did, would you do it?
My job as a doctor is to look at each individual situation.
I mean,
but I
I'm
have
sorry, I don't
never-
mean to be rude, but I can tell neither you nor the professor will answer my question.
I
I
have
think
nev-
you both have an opinion, and I don't understand why you won't share it.
I
We're
have
going to solve this
provided-
problem.
I've
Doctor-
provided care for a
Doctor,
few
how
years,
about
and I've
you?
never
Could you-
seen that situation.
How about you, Doc? Would you?
I do not support unfettered abortion, and I would like to point out that if a woman did have a life-threatening condition in pregnancy past approximately 22 weeks, that baby can be delivered alive by induction or C-section, and we can try to save that baby. The intent of abortion is a dead baby, and that is not necessary in that situation.
I mean, I want you to all understand where I'm coming from. This is a tough issue. And it's a tough issue because there's some tough questions we've got to answer. And when you won't answer the questions, when you're invited by my Democratic friends, the majority, and you won't answer the most fundamental question, we've got a bill in front of us that will basically say a woman has the unfettered right to abort at any time for any reason up to the moment of birth. And that's a gut check issue. And I would expect you as experts to answer that truthfully, how you do it. Thank you.